Our efforts include increasing breastfeeding rates throughout Niagara County. We know through evidence-based research and outcomes that breastfeeding exclusively for the first 12 months of an infant's life has both for the mother and infant long-term health benefits and reduction in the incidence of chronic disease and immune disorders. It is our goal to reach out into disparate communities. In Niagara County, we have high poverty rates. Within that population, most of those who live in poverty are young women and their children. We hope to target these disparate groups with our project. That includes a number of Hispanic and African American individuals within that group. And it also includes that population that has a high teenage pregnancy rate. Many of these moms are also working poor. So we are hoping to target many of the employers, academia, and these populations in these disparate communities to help promote breastfeeding. We intend to do an intensive educational campaign, and we also want to take an all-of-community approach to have a large community outreach event that will take place at one of the high schools. This high school happens to be located in Niagara Falls, where we have the highest teenage pregnancy rate and also the highest poverty rates. So, we have a great community need because Niagara County has one of the worst public health rankings in New York State. Our health outcomes ranked 57 for poor outcomes out of 62 counties. And the primary problems are obesity, chronic diseases, and immune disorders. We have found that through research that breastfeeding exclusively within the first 12 months of an infant's life has long-term health benefits for both mother and baby in the realm of decreasing chronic diseases and immune disorders. Our timeline, our goal is to complete within 1 year of receiving our funding, although we have already begun initiating, like forming our collaboratives, reaching out to people. We posted, we did a press release, we posted it on our county website, it was on our Facebook site, and we are getting responses from the community, from women who are breastfeeders who hope to support us. Many of these people come from major workplaces or are in academia or work for corporations that we wish to form partnerships with to help support those unfunded parts of this grant for promotion and to help bring resources for the young mothers and the families that come to this event. In addition, we have formed partnerships with other collaboratives that focus on infant and women's health. But more than that, we hope to include those support systems or significant others that surround those young women that may be thinking about becoming pregnant or may become pregnant accidentally and already are pregnant, but to also educate, for example, the extended families in the African American community, which the grandmothers, the fathers, and siblings that live in one household. Educate that whole family unit to promote breastfeeding. We know that exclusive breastfeeding for the first year of life is really important. Our breastfeeding rates in Niagara County are very low. There's a poor initiation rate, and then only 25% or less of mothers are still breastfeeding at the 1-year mark. Less than 50% are breastfeeding at the 6-month mark. So we're hoping to promote initiation, make it a cultural and social norm so that it is acceptable in our community, and also create breastfeeding-friendly environments for these young mothers who might work in lower-paying jobs that the employees may not present accommodations for the mothers or even be aware. This will help them to continue working, but also help to continue nursing their babies. Our unit is already so closely involved with the community for diabetes prevention, for chronic disease prevention, for cleaning up the environment. All this does is add another prong to our multi-pronged approach to improve the public health in Niagara County. So I think that it's just another way for them to get out into the community and engage with the community. There's social capital in this for our volunteers. We have both medical volunteers and non-medical volunteers. It gives them an opportunity to be out there and also to learn different processes. One of the things they'll be doing is disseminating a survey. They're going to be going into these populations that may be hard to reach by other means and get that survey tool out to them to have them understand, or to give us an understanding what they know about breastfeeding and the benefits versus formula feeding. The way I look at it, we are all one community. No one in our community has any more human worth than anyone else. I think this helps to kind of equalize, in a way, health in our community. It helps us take that path to equalizing access to health, and also the health education of our community, to raise our standards of health, to raise our opportunities to connect with each other. And I think this is really important, especially with volunteers. We know that most of our endeavors with our volunteers trigger interest of community members, and we've been able to gain additional volunteers to help complete our mission or to expand our missions in the community. So this is really important to us. We're very concerned as public health agency about the health of our community and our ranking, and we see this as an extremely important way to get the community engaged about something they may not know anything about. Coming from our own volunteers, our Medical Reserve Corps is the community, and that's really important. They are of the community, and they are the community. So, and they know many people within it. They come from all walks of life, and I just feel that this is a perfect opportunity for us.